We have a number of tests that are commonly used to evaluate the size of the aorta. And a lot of times we'll actually be referred a patient who had one of these tests for a completely different reason, that they happen to find this as an incidental finding, meaning somebody showed up to the emergency room or to their doctor's office, they're having some problem with a cough, and they're not able to figure out what the story is. They get a CAT scan. Maybe they were looking for a pneumonia or a lung nodule, but they turn out to have an incidental finding of a modestly dilated ascending aorta or an aneurysm. That's a great way to find out about your aorta. We love when we find them by accident because those are the ones that are easiest to prevent an aortic complication. One is echocardiography, which is heart ultrasound. Patients may get a heart ultrasound as part of a routine cardiac evaluation. Somebody who is short of breath has an EKG finding of interest. So those are somebody who has a murmur, for instance. Those are patients who might have an echocardiogram, and again, we might see a dilated aorta. Echocardiography is probably the least accurate of all of these modalities. It's a two-dimensional study that kind of can only see the aorta in certain planes and can only see the very first segment of the aorta. So if we ever see an aneurysm on an echocardiogram, we would usually say this patient needs a real aortic study, which goes on to the next two, which are CAT scans and MRIs. When it comes to CAT scans and MRIs, CAT scans are the highest definition. But CAT scans come with a little bit of a price, which are radiation if you're going to get a really good CAT scan. You can do CAT scans without intravenous contrast, but they're not as accurate. So the best kind of CAT scan you can get is the highest def, but it's also the most penalty for the patient in terms of radiation. MRI is probably the best of all these three because it's a three-dimensional imaging modality that does not require any radiation, and at least in our program does not require any intravenous contrast agent. And that's probably the best way to follow aortas over time because radiation is a cumulative toxicity. So if you got CAT scans every year of your life from the time you're a young person to follow your aneurysm, all of that radiation is building up over time. It's not like a single dose of radiation and then it wears off. You kind of absorb it and it stays with you. So MRI is high def enough, can tell us some interesting things about the aortic behavior in addition to the aortic geometry. And it's for us, that's the test of choice for long-term surveillance.